Now we go to the 5 transporting points, characteristics, and functions. Now we have here the table for the characteristics and function of the 5 transporting points. For the description on the spiritual axis, chapter 1, the well points, chi goes out in the spring, chi is swift and slips. For the spring point, chi pours. For the river, chi moves, goes, and the sea point, chi enters. Other description for the well, like spring head, chi of channel, comes out, chi is small, superficial. For the spring point, minute trickle from a spring, chi begins to flow, chi flows swiftly. To the stream point, like water flowing from a surface to depth, chi irrigates the body. For the river points, like water freely flowing in a river, chi flowing in the channel, chi is bigger. For the sea points, like many river streams returning to the sea, chi of channel comes to an end, chi is vast and deep, it comes together. For the spiritual axis, chapter 2 and chapter 6, the well points are the points of departure of chi. For the spring, point of convergence. For the stream points, point of entry of pathogenic factors. For the river points, it is the concentration point. For the sea point, chi joins body circulation. For the classic of difficulties, chapter heart, mental irritation. Spring points are hot sensation, heat diseases. Stream is for heaviness of the body, painful joints, painful obstruction syndrome. River points is breathlessness, coughing, feeling hot and cold, lung diseases. The sea points are the rebellious chi, diarrhea, digestion, diseases of young organs. For the spiritual axis, chapter 44, the well points are when yin organs are affected, spring, when illness manifests on complexion. For the stream points, when illness characterized by amelioration and aggravation. We use river points when illness reflects in the voice, and we use sea points for stomach diseases. In spiritual axis, chapter 4, we use spring for the exterior diseases, young channel, the stream for exterior diseases, young channel, and we use sea points for interior diseases, young organs. Spiritual axis, chapter 6, we use spring points for yin organ, yin channels. We use stream points for yin organs, yin channels, and river points for sinews and bones, and the sea points for skin and muscles. The 5 transporting points according to the 5 elements, tonification and drainage points according to the mother-child relationship. Use of element points to expel relevant pathogenic factors. The 5 transporting points to expel pathogenic factors. Wood is for the wind, fire for heat or fire, earth for dampness, metal, none, and water for cold. We can now summarize the action of the 5 transporting points according to the various perspectives explored above. The well points for the classic of difficulties, for fullness under the heart, mental restlessness, anxiety. Chapter 44 of spiritual axis, well points is to treat yin organs. According to seasons, well points for the winter, according to pathogenic factor and 5 elements, well points is to expel wind. Next is the string points. In the classic of difficulties, spring points is for the hot sensation of the body to clear heat. Chapter 44 of the spiritual axis, spring points is used when there is a change in the complexion. Spring points in chapter 4 of the spiritual axis, it is used for channel problems together with stream points. In chapter 6 of the spiritual axis, string points is for yin organ problems together with string points, spring points of yin channel. According to season, it is used in spring. According to pathogenic factor of 5 elements is to clear heat. String points in classic of difficulties for feeling, it is used for feeling of heaviness and joint pain to resolve dampness, painful obstruction syndrome. In chapter 44 of spiritual axis, when there are intermittent symptoms. Chapter 4 of the spiritual axis, string points is for channel problems together with spring points. Chapter 6 of the spiritual axis for yin organ problems together with spring points of yin channels. According to season, it is used in summer. According to pathogenic factor of 5 elements, it will solve dampness or phlegm. River points. Next is river points. In classic of difficulties, it is used in fog, breathlessness, cough, and hot and cold sensation, cough, asthma. In chapter 44 of spiritual axis, river points is used when voice is affected. In chapter 6 of spiritual axis, for sinews and bones, river joint of the yin channel. According to season, in river points is used in late summer. Next is the C points. For classic of difficulties, C points is used for rebellious qi and diarrhea, digestive disorder. In chapter 44 of the spiritual axis, C points is used for stomach diseases. Chapter 4 of the spiritual axis for internal yang organ problems. Dali lang. Chapter 6 of the spiritual axis for skin problems, C points of yang channels. According to season, it is used in autumn. According to pathogenic factor of 5 elements, it is to expel cold. Thank you for your attention.
Let's discuss stomach 42, a source Yuan point, rushing yang. Stomach 42 is located on the highest point of the dorsum of the foot between the tendons of the external hallucis longus and the extensor digitorum longus, directly lateral to the point where the dorsalis pedis artery may be palpated. The point is bordered proximally by the second and third metatarsal bones and distally by the second and third cuneiform bones. Alternative location for stomach 42. This may be located lateral to the medial portion of the extensor digitorum longus tendon, joining the second toe. How to find stomach 42? With the palpating finger, glide from stomach 43, which is in the depression between the base of the second and third metatarsal bones, proximally towards stomach 41, in the depression between the tendons of extensor digitorum longus and hallucis longus. Locate stomach 42 at the highest point of the dorsum of the foot in a depression lateral to the pulse. In most cases, stomach 42 is located lateral to the tendon of the external hallucis longus, which becomes more distinct by extending the big toe. Needling vertically 0.2 to 0.5 soon. Caution, dorsalis pedis artery. Indications and actions of stomach 42: clears heat from the stomach channel, regulates the stomach, calms the shen, opens the channel and luo vessels. Special features: Yuan-source point and an exit point. Stomach 42 can tonify the stomach and the spleen as it is the source point. Combined with triple burner 4, it powerfully tonifies the middle burner and dispels cold from the joints and is used for painful obstruction syndrome from cold. Stomach 42 also opens the mind's orifices and is used for mental illness. So to summarize, stomach 42 as a source point tonifies the stomach. It opens the mind's orifices, removes obstructions from the channel. In terms of its actions and indications, stomach 42 is similar to stomach 41, although less commonly used in current-day clinical practice. Stomach 42 is located over the pulsation of the dorsalis pedis artery, and the essential question suggests that the knee be raised in order to allow the artery to pulsate more clearly and thus assist in locating this point. This advice is echoed by the traditional observation that if the point stomach 36 is obstructed, the beating of the artery will be diminished. And in fact, if the stomach 36 is pressed firmly, the pulsation will disappear entirely. Combinations. For facial swelling, we can combine stomach 42 with stomach 25, stomach 40, stomach 40, and stomach 45 and stomach 43. For tooth decay, we combine stomach 42 with gallbladder 7. For mania, or desire to ascend to high places and sing, discards clothing and runs around, we combine stomach 42 with heart 7 and SI3. For mania disorder with rush behavior, desiring to ascend to high places and sing, discarding clothing and running around, stomach 42 can be combined with stomach 40. Flaccidity of the legs, we combine stomach 42 with GB34, liver 3, and GB40. For one-sided wind or hemiplegia, we combine stomach 42 with lung 7. Thank you very much for your attention.
Let's now go to LI6, or the VEERING passage point, as we continue our discussion on the Luo-connecting points. So LI6 is located 3 tune proximal to LI5, which is in the center of the anatomical snuff box, on the line connecting LI5 and LI11, between the abductor pollicis longus and extensor pollicis brevis muscles, at the level of the junction of the tendon, between the tendon and the muscle. So how to find LI6? First, we have to note that the course of the line connecting LI5 and LI11 depends on the position of the forearm. For location purposes, a mid position of the forearm with flexed elbow is recommended. So to locate LI6, measure 3 tune or 1 hand's breadth from LI5 at the center of the anatomical snuff box on the connecting line. Or we can use the tiger mouth grip method, wherein we spread the thumb and index finger of both hands, crossing them so that the forefinger of one hand comes to rest on the styloid process of the other, but avoiding bending the wrist. Place the middle finger against the forefinger. LI6 is located directly below the tip of the middle finger. Located at the same level, which is 3 tune proximal to the wrist joint space on the dorsal side of the forearm, are triple burner 6 in the depression between the radius and the muscle, and triple burner 7 in the depression between the ulna and the muscle, as well as pericardium 5 on the ventral side of the forearm between the tendons. Okay. We needle LI6 obliquely or transversely or subcutaneously 0.5 to 1 tune. For its actions and indications, LI6 expels wind and clears heat. It regulates and opens the water passages and opens a channel in the Luo vessels. For its special feature, LI6 is the Luo connecting point and the major point of the LI channel for regulating the water passages. LI6 is an important point to regulate the lung's water passages. That is, whenever the lung function of controlling water passages is impaired. This can happen when an exterior pathogenic factor obstructs the circulation of defensive qi in the space between the skin and muscles, giving rise to edema of the face and hands. This can also happen in chronic conditions of lung qi deficiency. So in summary, LI6 is an important point to regulate the lungs' water passages and therefore the movement and transformation of fluids in the upper burner. LI6 is the Luo-connecting point of the large intestine channel from where the Luo-connecting channel diverges, hence the name VEERING passage. From this point, the Luo-connecting channel ascends to the jaw and ears, whilst the large intestine primary channel traverses the lower jaw, nose, and face before joining the stomach channel, which connects to the eye. Like many distal points of the large intestine channel, LI6 is effective in clearing wind and heat from all these areas. Example, toothache, in redness and pain of the eyes, in nosebleed, rhinitis, etc. And LI6 is especially applicable for ear disorders such as tinnitus and deafness due to attack of exterior pathogenic wind and heat. The Luo-connecting channel from LI6 joins with the interiorly-exteriorly coupled lung channel. The guide to the classics of acupuncture states the Luo-connecting points are located between two channels. If they are punctured, symptoms of the interiorly-exteriorly related channels can be treated. The young large intestine channel may be seen as the outer reflection of its coupled yin lung channel, and its points are frequently used to release the exterior portion of the lung system. When external wind disrupts the function of the lung in regulating the water passages, there may be acute edema, especially of the upper part of the body, accompanied by absence of sweating and difficult urination. LI6 is the primary point of the large intestine channel to open and regulate the water passages and thus treat such symptoms as difficult urination, edema, ascites, and borborygmus with edema. Finally, the great compendium of acupuncture and moxibustion gives specific indications for excess and deficiency of the Luo-connecting points. In the case of LI6, they are tooth decay and deafness for excess, cold teeth and obstruction of the diaphragm in deficiency. Thank you for your attention.
Now we continue with the back transporting points. Bladder 19, the gallbladder shoe. Bladder 19 is located 1.5 June lateral to the posterior midline on the level of the lower border of the spinous process of the thoracic vertebra, T10. How to find? Let the patient is in a standing position with the arms hanging down. The spinous process of T7 is approximately on the level of the inferior angle of the scapula. From there, count down 3 spinous processes to the spinous process of T10. The bladder 19 is located on the level of the lower border of its spinous process and 1.5 June lateral to the midline at the highest point of the paraspinal musculature. Or use C7 as a reference point. From there, count down 10 spinous processes to T10 and locate bladder 19. 1.5 June lateral to the lower border of its spinous process, or use the lumbar spine as a reference point. Located on the same level are DO7 on the midline, a point of EXB2, 0.5 June lateral to the midline, and bladder 48, 3 June lateral to the midline. Needling, we use 0.5 to 1 June obliquely towards the spine. In clinical practice, this point is often needled transversely, subcutaneously towards the spine. This allows the patient to lie in a supine position during needle retention. The needles can be secured with tape. Caution, pneumothorax. For the action and indication, bladder 19 clears damp heat from the liver and gallbladder It expels pathogenic factors from the Xiaoyang. It tonifies and regulates the gallbladder qi. It invites the chest and relaxes the pathway of the channel. Bladder 19 special features. This one is a back-shoe point of the gallbladder, important point for clearing damp heat from the liver and gallbladder. Bladder 19 is an important point to resolve damp heat from the liver and gallbladder and is therefore used in cholecystitis and jaundice. It pacifies the stomach and subdues rebellious stomach qi, which makes it useful to treat belching, nausea, and vomiting. Similar to bladder 17, it relaxes the diaphragm and is used for hiccup and a feeling of fullness under the diaphragm, usually caused by stagnation of liver qi. The gallbladder pertains to the lesser yang, and bladder 19 is an important point to eliminate pathogenic factors from the lesser yang in the lesser yang pattern within the 6 stages, or the pattern of gallbladder heat within the 4 levels. Summary of functions. Bladder 19, resolve damp heat in the liver and gallbladder for jaundice, yellow sclera, bitter taste. It subdues rebellious qi for distension and pain of the chest and hypochondrium, vomiting, difficulty in swallowing, retching. Bladder 19 tonifies gallbladder qi for timidity, dithering, depression, palpitations. It regulates the lesser yang, alternation of feeling of heat and feeling of cold, dry throat, blurred vision, hypochondrial distension. Bladder 19 also tonifies deficiency, steaming bones, night sweating, fever from yin deficiency, dry throat. Bladder 19 is a back-shoe point of the gallbladder where the qi of the gallbladder emanates from the interior to the body surface. It is an important point to clear damp heat from the gallbladder and liver, which give rise to the classic symptoms of jaundice with yellow eyes, vomiting, distension of the lateral costal region, and bitter taste in the mouth. Damp heat in the gallbladder and liver may arise in the following ways. First, stagnation of liver qi, but generates heat and invades the spleen, suppresses its transportation and transformation function, and leading to the formation of dampness. Secondly, the spleen deficiency leads to failure of its transportation and transformation function and subsequent formation of dampness, which either stagnates and ferments over time and transforms to damp heat and combines with pre-existing liver stagnant heat. Third, invasion of exterior damp heat. Fourth, consumption of contaminated food or overconsumption of greasy, rich, or spicy food and alcohol. In all cases, the damp heat impairs the gallbladder function of secreting bile, and whatever the etiology, bladder 19 is indicated. According to both the spiritual pivot and the essential questions, Taiyang is the opening, Yang Min is the closing, and Xiaoyang is the pivot. In the treatise on injury by cold by Sang Hong Jing, Xiaoyang pattern denotes the stage where the pathogen is half exterior, half interior. In other words, the pathogenic factor resides between the Taiyang, which is the exterior, and Yang Min, the interior levels. And in this sense, Xiaoyang is the pivot or hinge between the exterior and interior. When the pathogenic factors disrupt the gallbladder function, it gives rise to the stagnation of qi, impairment of the stomach descending function, and uprising of gallbladder heat. The clinical manifestation of Xiaoyang pattern include the alternating fever and chills, dry throat, blurred vision, bitter taste in the mouth, fullness and distension of the chest and lateral costal region, and vomiting and nausea. All but the first of these symptoms are classical indication for bladder 19. According to 5-phase theory, wood is the mother of fire, and disorders of either the liver or gallbladder would may coexist with or be transmitted to the heart, which belongs to fire. In the case of gallbladder, there are two main patterns of disharmony which may give rise to disturbance of the heart and the spirit. First, the gallbladder Qi deficiency, and second, gallbladder damp heat combined with stomach phlegm heat. According to the essential questions, the gallbladder is the upright official from where judgment emanates. If there is sudden fright, unusual or abrupt noise or shock, or continuous fear and pride, whether in the formative years of childhood or as an adult, the qi of the gallbladder will be injured, giving rise to palpitation, restless sleep, or insomnia, inability to sleep alone, mental restlessness, susceptibility, timidity and fear, and indecisiveness. The gallbladder qi can only be injured, however, when the heart qi is also weak. This was emphasized both in achieving longevity by guarding the source, the 7th century classic by Gong Ting Sin, which said susceptibility to fright, timidity in which the patient fears being apprehended, all result from deficiency of qi of heart and gallbladder. In the essential readings from the medical tradition, which explains when the qi of the heart and gallbladder is strong, sudden fright and danger will not cause disease. However, if the qi is deficient, it will be harmful. In the case of gallbladder damp heat combined with stomach phlegm heat, there may be insomnia, palpitation, and anxiety accompanied by bitter taste in the mouth, vomiting, and distension and pain of the chest and lateral costal region. In the treatment of both this pattern, bladder 19 forms an important part of the point prescription. Finally, bilateral bladder 17, bladder 19 are known as the 4 flowers, indicated for steaming bone, taxation fever, deficiency taxation, tidal fever, etc. Thank you for your attention.
Let's now discuss REN5 or stone gate as a front collecting or front move point. REN5 is located on the anterior midline 2 Chun inferior to the umbilicus or 3 Chun superior to the upper border of the pubic symphysis. How to find REN5? The distance between the center of the umbilicus and the upper border of the pubic symphysis is divided into 5 Chun, which can vary considerably from the patient's finger Chun. Therefore, only proportional Chun measurement should be used here. A helpful device would be an elastic tape. REN5 is located on the midline 2 Chun inferior to the umbilicus. Located on the same level are kidney 14, which is 0.5 Chun lateral to the midline, and stomach 27, 2 Chun lateral to the midline. Needling vertically 0.5 to 1 Chun. Caution, rupture of the peritoneum and pregnancy. Actions or indications of REN5, moves and benefits, water passages, regulates qi and blood in the lower burner, regulates uterus. Special features. REN5 is front move point of the triple burner. Some classic texts warn that needling this point in women can lead to infertility. Hence the name, infertile women were referred to as stone women. There are no such warnings in modern texts. In order to understand the function of this point, one must recall the role of the triple burner in relation to original qi or yuan qi. The original qi arises from between the kidneys and spreads to the 5 yin and 6 yang organs via the intermediary of the triple burner. REN5 is the front collecting move point of the triple burner and rouses the original qi to circulate to all the organs and channels. It can therefore be used to tonify original qi in persons with kidney deficiency and a poor constitution. Another important function of the triple burner, specifically the lower burner, is to transform and excrete fluids and to ensure that the water passages of the lower burner are open. REN5 stimulates this function of the triple burner, specifically the lower burner. Its use is therefore indicated for edema of the abdomen, urinary retention, difficult urination, diarrhea, or vaginal discharge. The triple burner relies on the smooth movement of qi and ascending, descending, and entering, exiting of qi in all cavities of the body. From this point of view, its function is similar to that of the liver in relation to the smooth flow of liver qi. REN5 stimulates free flow of qi and the entering, exiting of qi in the lower abdomen. When this function is impaired, there may be pain in the lower abdomen. Hernial and genitourinary disorders, the SHON, umbilical pain, and running piglet syndrome, for which this point is indicated. It is worth noting the presence of the word men, the door, in the point's name. Generally, all points with door in their name promote entering and exiting of qi. REN5 is like a door through which the qi of the directing vessel goes in and out. REN5 is used for menstrual disorders, but its action is not so strong and general as that of REN4. With regard to menstrual disorders, the main difference between these 2 points is that REN5 is better when there is dampness in the lower burner or phlegm in the uterus. To summarize, REN5 opens the water passages and promotes transformation and excretion of fluids in the lower burner, like difficult urination, retention of urine, painful urination, dark urine, edema, diarrhea, genital itching, swelling of scrotum, swelling of vulva, swelling of the penis. REN5 regulates qi in the lower burner. So when there is twisting pain in the lower abdomen, hernial and genitourinary disorders, umbilical pain, retraction of testicles, running piglet syndrome. REN5 regulates the uterus. So this is very good for persistent lochial discharge, abdominal masses, heavy periods, stone-like hardness of the lower abdomen. And finally, REN5 strengthens the original qi. So it's very useful in cases of exhaustion. Thank you very much for your attention.
Let's now talk about kidney 5 or the water spring point as we continue to discuss the shift left or the accumulation points. Kidney 5 is located 1 tune distal to kidney 3 in a depression over the joint space between the talus and the calcaneus. How to find kidney 5? First, we locate kidney 3 on the level of the highest prominence of the medial malleolus in a depression between the malleolus and the Achilles tendon. From kidney 3, palpate 1 tune in an inferior direction to a palpable depression over the joint space between the talus and calcaneus. This is the location of kidney 5. We needle kidney 5.3 to 0.5 tune obliquely to vertically superior to the margin of the bone. As for its actions and indications, kidney 5 regulates the CHONGYANG and REN5 and benefits menstruation and urination. For its special features, kidney 5 is the shift left point of the kidney meridian. It is specially indicated for acute disorders and painful condition. Being the accumulation point, kidney 5 can be used in acute conditions to stop pain and is therefore used in acute cystitis and urethritis. It also stops abdominal pain around the umbilicus and it regulates blood in the uterus. In particular, it is used for amenorrhea from kidney deficiency. To summarize its function, kidney 5 benefits urination in difficult urination or dribbling of urine. It also regulates the uterus and menstruation in cases of scanty menstruation, in scanty periods, amenorrhea, irregular menstruation, painful periods, and prolapse of uterus. Kidney 5 is the cheek left point of the kidney channel. The cheek left points are where the chi and blood, which flows relatively superficially along the channels from the genual points, gather and plunge more deeply. The cheek left points in general are indicated in the treatment of acute conditions and pain, because the cheek left points of the yin channels have an additional action of treating disorders of blood. There is an intimate relationship between the kidneys, the uterus, blood, and menstruation. The essential question says, the vessel of the uterus connects with the kidneys, and at the age of 14, the tiangui matures. The conception vessel flows and the penetrating vessel fills. The menses come according to the times, thus conception is possible. Normal development of the uterus and the conception and penetrating vessels depend on healthy functioning of the kidneys and maturation of the kidney essence. At the same time, harmonious menstruation depends on adequate formation of blood in the body, especially the liver blood, which flows to the conception and penetrating vessels to form menstrual blood. The close relationship between the kidneys and the liver blood was emphasized in comprehensive medicine according to Master Zhang, which said, when the essence is not discharged, it will return to the liver and transform into clear blood. Because the kidneys themselves plays an important role in the formation of blood, stated unequivocally in disease mechanisms according to Master Shah. The source of blood is the kidneys. If the kidneys are deficient, then the function of the conception and penetrating vessels will be disturbed and the formation of blood impaired. Kidney 5, the cheek left point of the kidney channel, and thus able to treat disorders of blood, regulates the chi and blood in the kidney, conception, and penetrating vessel. It is indicated for a variety of menstrual disorders, such as amenorrhea, irregular menstruation, dysmenorrhea, and delayed menstruation with oppression and pain below the heart on onset of menstruation, whether characterized by deficiency of blood or chi, or excess in stasis of blood. As for point combinations, amenorrhea with oppression and pain below the heart. Kidney 5 can be used in combination with kidney 6. For irregular menstruation, kidney 5 can be combined with stomach 25. For uterine prolapse, kidney 5 can be combined with kidney 6, bladder 62, and liver 8. Thank you for your attention.
Now we continue with the gathering points. Gallbladder 39, the Great Shuttle. Bladder 39 is located 3 proximal to the highest prominence of the lateral malleolus on the anterior border of the fibula. How to find from the highest prominence on the lateral malleolus, measure 3 tune, 1 hand breadth in the proximal direction and locate GB39 in a depression on the anterior border of the fibula. According to some authors, it is located between posterior border of the fibula and the tendon of the peroneus longus and brevis muscles. When in doubt, choose the more pressure-sensitive point. Located on the same level, but 3 tune proximal is the bladder 60. Depression between the malleolus and the Achilles tendon is the bladder 59. In a comparable position but on medial aspect of the leg is the spleen 6. 3 proximal to the highest prominence of the medial malleolus, meeting point of the 3 legging channels. Needling vertically 1 to 1.5 tune. For the action, gallbladder 39 opens the channel, benefits the tendon and bones, benefits the marrows, clear wind dampness, clear heat from the gallbladder. Special features: meeting point of the marrow, important distal point for disorders of the cervical spine. The most important function of GB39 is that of nourishing the marrow. However, judging by the indication of this point, it seems to affect the bone marrow more than the marrow and the brain. It is indicated in chronic bone painful obstruction syndrome, or the B syndrome, which is characterized by a deficiency of the liver and kidney and of the sinews and bones. This point nourishes the bones by nourishing the bone marrow. The regular use of this point in old people is said to help to prevent wind stroke. Apart from this, it is an important point to remove obstruction from the lesser yang channel from the lateral side of the neck, especially when the neck is very stiff and the person cannot turn the neck from side to side. In such cases, the needle is reduced quite vigorously while the patient is asked to gently turn the head from side to side. The GB39 in its capacity of gathering point of the marrow. To treat the neck, prefer an extra point that is near GB39 on the gallbladder channel. This point is called Yu-ju, which means disappearing bone. It is called thus because the point is located by palpating the fibula starting from below the GB39. The point Yu-ju is situated at the hollow where the fibula is not felt any longer as it disappears below the overlying muscles. The point is usually higher than the GB39. For the summary function, GB39 subdues liver yang, those with headache, dizziness, stiff neck. It also expels wind, stiff and painful neck, inability to turn head, painful obstruction syndrome, the B syndrome of the neck. It also nourishes marrow and bone marrow. GB39 is the meeting point of the marrow, which is the source of both the sea of marrow, the brain, and the bone marrow. There's little evidence in the classical text of the ability of the GB39 to nourish the sea of marrow, in other words, to treat diseases of the head and brain, and even headache and dizziness are modern rather than traditional indications. GB39, however, has a strong action on benefiting the bone marrow, sinews, and bones, and is indicated for a wide range of disorders characterized by weakness, laxity, contraction, and pain of the limbs. This latter action is comprehended by its ability to dispel wind damp. According to the essential questions, in bone painful obstruction, the pathogenic factor reaches the kidneys. In sinus painful obstruction, it reaches the liver. In chronic painful obstruction, therefore, prolonged retention of wind damp which injures the sinews and bones will eventually deplete the liver and kidneys and hence the marrow. Prolonged deficiency of the liver and kidneys and insufficiency of essence resulting in malnourishment of the sinews may also give rise to atrophy disorder. By its action of nourishing the marrow and benefiting the sinews and bones, GB39 is therefore indicated for both chronic painful obstruction and atrophy disorder, hence the reference to the use of GB39 in wind taxation with heaviness of the body. Injury by cold pathogen leading to taxation and deficiency taxation. The term taxation here denotes the extreme deficiency that arises due to chronic retention of pathogenic factors. According to the Ode to elucidate mysteries, the Great Han Dynasty physician who thought needle GB39 and GB30 for lameness of the legs, and immediately the patient was able to walk. The gallbladder primary and sinuous channel pass through different portions of the neck by virtue of its action benefiting the sinews and bones and activating the channel and alleviating pain. GB39 is the main distal point of the gallbladder channel for disorder of the neck, both acute and chronic. GB39 has a further action of promoting the smooth flow of liver and gallbladder qi and clearing gallbladder fire primarily arising from the transformation of stagnant qi. It is indicated for distension of the chest, anxiety, indignation, anger, and mania. Gallbladder fire may easily transmit to the stomach, resulting in stomach heat or obstruct the stomach descending function, leading to lack of appetite. The gallbladder sinew channel binds at the side of the nose, and the primary channel connects with the governing vessel at the DO1 by clearing gallbladder fire. GB39 is also indicated for dryness of the nose, nosebleed, and hemorrhoids. Thank you for your attention.
Now let's talk about chronic fatigue syndrome, featuring the pattern lung and spleen qi deficiency. Clinical manifestations: tiredness, worse in the mornings, slight ache in the muscles, muscle fatigue after only slight exertion, shortness of breath, weak voice, spontaneous daytime sweating, poor appetite, slight epigastric and abdominal distension, and loose stools. Tongue is pale, pulse empty. If heart qi is deficient, there will be palpitations. Qi deficiency is the most common eventual outcome of an invasion of wind, complicated by a subsequent residual pathogenic factor. Dampness impairs ascending of spleen qi and therefore leads in time to weakening of qi. However, chronic fatigue syndrome is unlikely to manifest purely with qi deficiency, as nearly always there will be some residual pathogenic factor, especially dampness. In treatment, it is necessary to evaluate relative importance of the qi deficiency or the strength of the pathogenic factor. If the condition is predominantly deficient, say 80%, it should be treated as deficiency. However, the prescription should be adopted in order to eliminate any residual pathogenic factor. So treatment principle: tonify qi primarily, expel any remaining pathogenic factor secondarily. Points: REN12, stomach 36, spleen 6, bladder 20, bladder 21, lung 9, DO12, bladder 13, REN6, LI10, DO20. All are reinforced. Moxa can be used unless there is some heat or damp heat left. REN12, stomach 36, spleen 6, bladder 20, and bladder 21 will tonify the stomach and spleen. Lung 9, DO12, and bladder 13 tonify lung qi. REN6 tonifies qi in general. LI10 tonifies qi and is particularly useful in combination with stomach 36 to reduce muscle ache and fatigue in the limbs. DO20 raises yang and lifts the mood, a very important consideration in this condition that can last for years and inevitably makes the person depressed. Now let's have some case history. We have a 40-year-old woman who had been suffering from CFS for the previous 6 years. All her symptoms started after contracting influenza during her second pregnancy. During this acute infection, she felt completely exhausted and could hardly walk. She never recovered after this infection and continued to feel exhausted, shivery, while experiencing a general flu-like feeling. Her muscles ached and felt very quickly fatigued after the slightest exercise. Her head felt muzzy and her short-term memory was poor. 4 years after the initial infection, she contracted a new one that severely aggravated her symptoms. She had a pain in the spine and occiput, numbness of her face, headache, sore eyes, breathlessness, palpitations, weakness of the right arm, diarrhea, and weak legs. She felt shivery and sweaty. This condition lasted for 5 months, most of which she spent in bed. At the time of her consultation, the symptoms had disappeared, but she still felt exhausted and shivery and had a flu-like feeling most of the time. The ache in the muscles had subsided while the fatigue remained. Her pulse was extremely fine, almost minute and weak, being virtually non-existent on the right front position, the lungs. Her tongue was pale, slightly swollen, and had a midline stomach crack. The present condition was very clearly predominantly deficient. There was a very obvious deficiency of lungs and spleen. Initial symptoms showed some dampness, evidenced by ache in the muscles. The aggravation 4 years later probably led to the exhaustion of qi. Treatment principle: tonify qi of the lungs and spleen. The acupuncture treatment consisted in reinforcing lung 9, stomach 36, spleen 6, LI10, bladder 20, bladder 13, do 12, bladder 21, and do 20. Thank you very much for your attention.